Welcome, folks. Just going to give it a couple seconds here and let people enter the meeting here. Please feel free to drop your name and where you're dialing in from in the chat. Love to hear where everyone is from. Welcome, folks. You have Texas, Wisconsin, New Jersey. That's my home state. Virginia. We got New York, California. Oh, good. Nebraska. Thank you all so much for joining us. Okay. All right, so let's get started here. I have a couple things I'd like to cover before we launch into our panel discussion, which I'm really excited for today. But hello and welcome to Workplace Mental Health Employer Perspective. My name is Taylor Adams. I use she, her pronouns. For a visual description, I am a white woman with straight brown hair. I'm wearing a black top and wearing purple earrings today. Just wanted to share that I also personally live with anxiety and depression, and is a big reason why I'm so passionate about the work that I do. I'm the Director of Workplace Mental Health at Mental Health America, or MHA, and also be the moderator for the discussion this afternoon. So this webinar is co-presented by MHA, which is the National Mental Health Advocacy Organization based in Alexandria, Virginia, and also the National Organization on Disability, or NOD, which seeks to increase employment opportunities for Americans with disabilities. Before we get started, I want to encourage you, and many of you already have, but introduce yourselves in the chat. Tell us your name, where you're coming from. I'm currently in Arlington, Virginia, in my dining room / craft studio, all in the same place here. This webinar will include a guided, but also an audience Q&A. We have time to get to your questions, so please type any questions you have for our speakers using the Q&A Zoom function. This webinar is being recorded and will be available within 1 month to the public. We do not offer continuing education units, but certificates of attendance will be available upon request after the event. And then finally, we will send out a survey post-webinar and would love for you to submit any feedback that you had to help us improve some of our webinars for the future. Jackie, if you can move to the next slide, please. So here, just a quick overview of what we'll be discussing today. So when Felicia and I from NOD were talking about how we wanted this panel to go, we were very intentional about picking speakers from different industries, different types of workforces, different sizes. And so we really wanted to understand what are the mental health challenges that their employees were experiencing as it relates to their industry and the different size and things like that. We'll talk a little bit about workplace policies and programs that have worked to meet those needs of workers, and then also the intersection of diversity, equity, inclusion, and your mental health efforts, particularly around workers living with mental health or substance use conditions. So with that, next slide, Jackie, I'll introduce our speakers. I won't go into too much detail because I want to allow them to give a quick little intro of themselves when they speak. But we have Carol Glazer, who is the president of the National Organization on Disability. We have Lori Golden, who is the Ability Strategy Leader at EY. We have Steve Linden, the Senior Manager of Total Rewards at Brinker International, who's also the owners of Chili's. And we have Jennifer Peconi, who is our Corporate Wellness Manager at Independent Health. So with that, we'll take down the slide so we can see our full panel here. Give me 1 second, doing 2 things at once. All right. Well, welcome everyone. Thank you so much for being here and joining me in this hour. Really appreciate it. Okay. So we have a couple questions to begin with, and then we will turn it over for a couple audience Q&As. This first question is for anyone. If you'd all like to respond, it's really up to you. But if we could start with Lori, Jen, Carol, and then Steve. With your industry and workforce in mind, what are some of the mental health challenges you've seen that your employees are experiencing at work? And that's kind of a negative note to end on, but we'll talk about solutions in the next part. So Lori, you want to kick us off?
That's fine, Taylor. Thank you. I'm Lori Golden. I am a white woman with short blonde hair, wearing glasses, wearing a white blouse right now in my home office, which you can't see because I have a screen up promoting digital accessibility, which is something that's very important to our diversity, equity, and inclusiveness efforts at EY. I live with a number of non-visible disabilities and have several family members with significant mental health issues. My pronouns are she and her. Now, to get to the question, EY is a professional services organization. We do tax, we do auditing, and we do consulting work and transaction advisory support work around the world. We have about 230,000 people globally and about 50,000 people in the US. So we're big. As professional services, we're a knowledge organization, and that means our only product is our people. And so it is, to use the cliche, a very high performance culture where a lot is expected of people. Consultants travel. In fact, many consultants travel most of the time, which can be physically and psychologically very stressful. I don't need to tell any of you. Our environment, professional services, is continually changing. We're changing internally, and our client environment, the marketplace, is constantly changing. And that means that people are dealing with a lot of uncertainty, a lot of dislocation, and a lot of need for continual upskilling and pressure to continually learn to do things in new ways, technologically, but in other ways too. Our people work very, very long hours, and particularly early in their career, very, very long hours, often with travel added to that. So it is a very rich environment, but it can also be a very stressful environment. So no surprise, burnout has been for years, perhaps the biggest issue. Second, and closely related to that, is of course anxiety and depression. And needless to say, the past few years with the pandemic, all of that has become not only accelerated, it's accelerating everywhere in society, but the compleximes of two-career families. Most of our people are in two-career families, and may have children or family that they are taking care of, who then with the pandemic were home, had to be homeschooled, or had to be brought into a different living situation. Some people lost elderly parents who were in care settings. The stresses of all of those family dynamics, not to mention the physical threats of COVID itself and the financial impacts that many families were feeling, accelerated everything. So like every organization, we've been hit with waves and waves, and I haven't even mentioned Black Lives Matter and Stop Asian Hate and the discord and in some cases violence and feelings of personal threat that so many of our people are experiencing. So it's been a tough couple of years for EY people, just like everybody else. But when we talk about what we do to support, that's the good side. We've done a lot and made a lot of progress.
That I think Jen.
Thank you. I'm Jennifer Peconi, Corporate Wellness Manager at Independent Health. I also sit on the board of MHA of Western New York. So both personally and professionally, I'm a huge mental health advocate. And certainly I can speak to Independent Health, but our team actually works with many large employer groups from all different industries and landscapes on worksite wellness. And honestly, we see a lot of the same concerns right now across the board. Stigma is still very much a barrier. And so people are afraid to talk about it at work. And collectively, attitudes and perceptions around mental health need to shift in the workplace. And that starts at the top. But specifically, I would say we're seeing a lot of emotional health issues, stress, anxiety, certainly depression. But we're also seeing a need for nonviolent communication training and changing the way people interact and communicate with each other. You know, we have less face-to-face time now, and that impacts trust, productivity, and overall well-being in the workplace. And COVID certainly brought forward a couple of other things, you know, from working, you know, from home and all the shutdowns. And we've all been kind of thrust into this environment that's almost an impossible situation to thrive in. So now we're trying to navigate the second tsunami of COVID, as I call it, and dealing with things that we've never dealt with before. I think most importantly, you know, we're hearing people want to feel seen and heard, and they want to know that they matter in an organization and that they have a voice and they have some sort of autonomy, because that's been ripped away from us the last 2 years. And so companies need to make it a priority to listen to what associates are saying. And there's so much happening, you know, outside of work as well, the economy and in the world. And, you know, all of these things together are bubbling up and creating this tremendous amount of stress and pressure. And this all filters into the workplace through mental and emotional health issues. And it impacts an organization's bottom line. So Independent Health is certainly committed to continuing to expand what we do, including around our mental health toolkit that we created a couple years ago, aimed not only at helping leaders, but all level associates, so that we can arm everyone with knowledge and self-help techniques and resources. And we do this through our worksite wellness programs.
Jen, I was just taking those notes because I know we'll get questions from folks who might be interested in that toolkit.
Sure.
And Carol, love to hear from you.
Sure. Well, I would only add to what's already been said, because, you know, I think it's clear that America is suffering right now, and that's manifesting itself in everybody's workplace. At NOD, I would only add that as a mission-driven organization, it's our job to worry about school shootings. It's our job to worry about the fact that America is in so many ways at war with ourselves and the dysfunction in Washington. It's our job to worry about the disproportionate effect that COVID has had on people with disabilities, including mental health challenges. Let me go back. I neglected to provide a description of myself. I am a tall white woman with short blonde hair. I have on glasses, and I'm speaking to you today from my home in Massachusetts. I also have a diagnosis of post-traumatic stress disorder, and that manifests itself with anxiety and depression. I want to take a moment and celebrate the fact that 3 people who have already spoken here today have been able to say that. We say it proudly, and we say it without fear of any sort of retribution in our workplaces. And that is a moment to celebrate, because it's a huge leap forward as far as stigma. So just to sum up, yes, we care deeply. We have to care deeply. We're paid to care deeply. And those things affect us in a way, in a sort of a double whammy.
Thanks, Carol. I love that you mentioned that, but I do have to say that if it wasn't for, you know, I'm totally comfortable disclosing that, especially in these types of environments where I think it's important. But if I didn't have MHA and the culture that they encourage, it'd be really difficult to do that. And I think that's why these conversations are so important, because not everyone is comfortable doing that. Anyways, Steve.
Yeah, hi, good morning, good afternoon, everyone. I am Steve Linden. I am with Brinker International, and as Taylor mentioned, that is the parent company to Chili's and Maggiano's. So hopefully everyone visits those restaurants and has a great experience.
Yay, yay, Chili's.
So I think we've already heard a lot of similar things that, you know, our team members face from a stress and mental health. The one thing I guess that might be a little bit different from our environment is we're a very public-facing employer. Our team members interact with not coworkers so much. I mean, they do obviously, but they interact with the public a lot. And so with, you know, everything that's happened the last couple of years with the pandemic and the labor market, the supply chain challenges, our team members are struggling with those issues, but then they're also struggling with the guests that come into our restaurants. They're struggling with the same issues. And we've actually seen a lot of increase in confrontations between either guests and team members or team member to team member. Those aren't necessarily new to the industry, but we've seen a significant amount of increase just because of everything that's happening in the world, all the stress, all the anxiety that people are dealing with. Not to mention that most of our team members now are, because of the labor shortage, they're overworked. They're having to do 2 to 3 different jobs at a time. And it's just becoming a very, very hard industry for our team members to make sure that our guests get a very positive experience, and because we want them to come back to our restaurants.
Steve, I realized we started on a really kind of low note, and I imagine that many of the folks joining us, a lot of this isn't a surprise because they're dealing it with themselves. They're people managers who are dealing it with it in their teams. Leaders, you know, I think that's often a group that's forgotten about because they're seen as being responsible for some of these issues, but taking care of themselves is really important. But I want to kind of shift from some of the things that are wrong to what's right. What are some of the things that you've seen, particularly with your workforce? And this could be programs, practices, informal, formal, whatever shape that takes, has worked and helped support both, you know, your employees and that journey that your organization's taking for better workplace mental health. And I'll start with Jen. Do you want to kick us off for this one?
Yeah, thank you. And I apologize, I did not provide a description of myself. So I am a white female with long, dirty blonde hair, and I have a red top on today. But I love our organization. We have such a great leadership team here, and we've really made mental health part of our culture. Our executive team has done numerous messages around this. We've changed policies, we've done trainings, we have cross-functional committees, and through our worksite wellness program here at Independent Health, we call it Healthy Me, which certainly focuses on multiple dimensions of wellness, but mental health has really been a large component of that since 2019. We recognize this growing trend and this need to address these mental, emotional health concerns. And so that's when we developed our mental health toolkit in early 2020. And it's really designed to help both leaders and associates sort of recognize, understand, and respond to the needs of our people and what might be going on within each of us. And our toolkit was originally focused on certain areas like stress, anxiety, and depression, but then we've since expanded to include things like substance use or embracing change or mindfulness, along with the importance of human connection. Our organization went further to develop very specific committees aimed at addressing things like diversity, inclusion, and belonging, associate engagement, and overall well-being and growth. We've held specific manager trainings and different challenges aimed at creating a mentally healthier workforce. We've even partnered with community organizations locally and held listening sessions. And we've executed on these things to be better and to do better. And so, you know, we try and recognize all of our associates in different ways. We just launched, we call it our Wall of Fame, which highlights associates both inside and outside of work. We've created flexible work schedules, which have shown, you know, to reduce stress, work-related stress. We have non-harassment policies, policies about not scheduling meetings during lunch to really allow people that time to themselves. We hold weekly live meditation and stretch sessions and lunch and learns and trivia and step challenges. We do pulse surveys, and we really listen to our associates, and then we evolve in everything we do. And leadership from the bottom all the way to our CEO is involved, and they really do make it part of our culture here at Independent Health. So not only focusing on physical health, but mental health as well.
You just you reminded me, it's like, yeah, taking a break for lunch. Am I doing
Yeah.
that today? Oh my goodness. We're on the East Coast. We scheduled this during a popular lunchtime. So I hope all of you are taking, you know, if you're listening, eating a meal on the side and taking care of yourselves
Yeah.
as well. Carol, did you want to go next?
Sure, yeah. Now, as a small organization, and those of you in the audience who run or are part of small organizations, I'm sure this will resonate. You know, we don't have a big HR budget. The person who's head of HR at NOD has about 4 other jobs. And so what we have to work with is a lot less than a lot of the companies on the Zoomcast. But what we do is Jen mentioned the flexibility that is so very important. We're very clear about goals and objectives, what we want to accomplish, but also very flexible about how those are achieved, about where those are achieved. I found out the other day that one of the people on our staff has been working out of Jamaica for the last two or 3 weeks, and I didn't know it. And I didn't care. It was fine because he does a superb job. He gets his work done, and it's to us, it's all the same. PTO is absolutely critically important, and it's something that we can do that is a non-monetary. On the monetary side, NOD is very careful about paying at the 75th percentile in terms of compensation. But PTO is something we really strictly enforce. We're generous about the number of days a year. We have summer Fridays. We have the week, generally the week between Christmas and New Year's. And we don't have any sort of quiet expectation that anybody's, you know, going to work on their PTO. And we have very strict use it or lose it policies with PTO because our people are so dedicated to their work that they tend to just work straight through and feel they don't need a vacation. And by the way, that flexibility is not the flexibility about which 16 hours of the day that we work, which a lot, you know, we seem to have figured out how to fill up our days and our nights with work because of remote work. We're very clear that a 16-hour day is not accessible or acceptable. And then finally, a lot of opportunities for feedback. And I know Jen mentioned that as well, but two-way evaluation, 360-degree evaluation. We're putting in place this year an employee engagement survey. Regularly surveying where people want to work, how people want to work, absolutely critically important. I want to talk about empathetic leadership, but I'll save it for another question, if I may, Taylor.
Oh
Let's
yeah,
start.
I've got you.
Good.
Yeah, no, thank you so much. And I thank you for mentioning, you know, about compensation. That is one thing in this past about year and a half that I've heard more and more organizations that we work with say that they're focusing on pay equity audits, you know, thinking about how their staff is being compensated for their time and efforts and being recognized in that way. To me, that was surprising because I do think there's a lot of crossover between financial stressors and all these different things that play into mental health concerns and issues in the workplace. So thank you, Carol. Really appreciate that. Steve, I'm gonna kick it to you.
Great. Well, I think to Jen's point, the leadership involvement is, I think, critical. So some of the things that we've done recently is we hold an annual conference every year for our restaurant managers to come to Dallas. Typically in the past, they've been, you know, a couple of days to celebrate, do recognition, talk about different products and trainings and things that are coming up. But in the last 2 years, what we've done is we've really shifted our mindset. And instead of talking about business, we've dedicated those couple of days specifically for our managers and to talk just about them, how important they are to us as an organization, and how we as an organization can support their physical health, mental health, and just make them be the best they can be, not just at work, but at home too. So we do an entire day of tools, resources, reminders, and different things that they can take back to their restaurants to be a more empathetic leader, a more compassionate leader. And then we'll send a lot of these information and tools and resources back to all the restaurants so people can really view the content that that the managers shared at the conference. We've also done a lot of things like enhanced our behavioral health benefits through our telehealth. We went to a $0 copay, so any of our team members that are enrolled in our medical plan can get access to behavioral health at $0 cost. We've enhanced our EAP benefits to all team members, regardless of full-time, part-time medical enrollment. And we've held a lot of trainings throughout the last couple of years too. Just again, I think a lot of us have already shared about leadership involvement, how to stamp out the stigma, and just really keeping it as part of our culture and top of mind. We're a very open, collaborative, almost like a family culture. And we talk about this stuff almost on a daily basis, whether it's in the home office or in every single restaurant. So those are a few things that we've done.
Finally, last but not least, Lori, I'm really excited to hear what you have to say on some solutions here.
Well, a pleasure to get to the good stuff. We follow a lot of the great practices that have been shared. So I can talk about those, but I'll talk about an evolution. We, as I mentioned, we're a knowledge company. Our only product is our people. So it's critically important that we care about and care for our people, and that our people care for one another, because we team. Virtually all our work is done in teams. We depend on our relationships to get our work done. If one member of the team is struggling, the entire team is impacted. So for many, many years, we've put a very strong focus on mental health supports as part of our employee assistance program. We have had full-time on-staff licensed clinicians for many, many years, in addition to vendors who can provide mental health support telephonically. And that's aside from our mental health benefits and our insurance. But around 6 years ago, we had a couple of pivotal events. There were a few suicides completed in 2 different offices. And needless to say, there was tremendous grief, but also tremendous guilt. Our people felt like they should have known, they should have done something, they were ill-equipped. People were pointing fingers at themselves. It was a very, very bad place to be, and we felt we needed to do something about that. So we developed a program that was initially called Are You Okay? It was grassroots led. I think it's notable that it was developed by our disabilities employee resource group. We call them networks. And it was a program to build awareness of mental health issues and how they affect our people, to create more openness, but as importantly, to give our people the tools to have the skills to have conversations with one another, to check in with one another. So we began educating people in a series of face-to-face events on how to recognize signs that somebody might be struggling with their own or friends or family issues, and then how to prepare for and how to structure a supportive conversation, and then refer to the many expert resources we have available and are available in the community. And those were tremendously successful. Our people bill for their hours. So everything they do voluntarily comes out of their day job, so to speak. And we had thousands of people attend dozens of events in our offices, which were organized by planning teams in the offices themselves. And one of our requirements in putting on these events is that they would be hosted by the highest level leader in the office. And that leader would begin with a personal story on how they connect to issues around mental illness or substance misuse. And that made a tremendous impact. In 1 year, we had a 45% increase in use of mental health resources through our EAP. But COVID, needless to say, changed everything. And we significantly stepped up both the expert resources that were available and the grassroots programs, training, information. So we went from 3 full-time clinicians on staff to 5 full-time clinicians. We began offering 25 no-cost sessions with licensed therapists. That's aside from people's own healthcare plans, and unlimited visits with a mental health coach. We had mindfulness classes, really wonderful 12-week mindful classes that were developed by our own people, taught by our own people. We actually elevated one of those people to be a full-time mindfulness leader who teaches different groups and conducts different classes all around the firm. And that's been modeled, speaking of from the top, as has been talked about. Our America's chairman on all firm webcasts had mindfulness sessions, where our mindfulness leader started out with doing a meditation with everybody to model that this is really important to us. Regular check-ins became an important part of our culture. Our leaders were required to have open office hours to talk about anything with their people, and to have regular one-on-one check-ins, not only when something's going wrong, but just to talk with each member of their team individually. And that expectation was set from our leadership. We also began shifting, and we're in the midst of this right now, from a focus on recognizing signs that people may be struggling to realize, and this happened a lot with the pandemic, that we had people who really ran into difficulties who showed nothing. There were no signs. There was nothing that was visible. So we began an effort to educate and prepare our people and create an expectation that we have regular, what we call caring conversations with one another as peers all the time. And that be a regular part of our practice. So our culture was already very people focused because it had to be, but with the stresses of the pandemic and the social unrest and the political divisiveness and everything that's gone on in the past few years, we really evolved to be even more proactive around actually caring for one another and showing how we do that.
Thanks, Lori. I'm just, I'm thinking when you mentioned regular check-ins, and Carol, I'm sure you can relate because the structure of our organizations are similar, cause-driven, we're a smaller workforce, but there are quite a few of us who are like just very self-driven and not really sure, when to ask for help, and there's no signs of it really. But those regular check-ins have been so important to be like, okay, slow down, even though everything is kind of under control. How are you? How are you doing with in the midst of all of this? So yeah, can't stress that enough. I'm so happy you mentioned that. The next question that I have is for Steve and Jen. But how do you think about, and Jen, I know you mentioned creating a new group and different things like that, but how do you consider DEI be, as part of your organization's overall mental health strategy? I know that's a very open-ended one. So.
Yeah, well, we have a couple core strategic pillars as part of our organization, and well-being and DE&I are at the very top of that foundation as part of our team member experience. And we have a saying, and as items on our menu come in all shapes, sizes, and flavors, no two team members are the same, and we truly believe that. So we kind of had a journey from our DE&I strategy, which started a couple of years ago with our Leadership Listens campaign. And we had our executives go out to many different restaurants, many different regions, and they just wanted to hear what was on our team members' mind. And it could have been wellness, it could have been benefits, it could have been operations, it could have been a lot of different things. But one consistent message that they heard through this entire leadership campaign or Leadership Listens campaign was community, purpose, and togetherness. And so that kind of prompted our DE&I strategy. And I don't think we're different than a lot of other organizations. We created our employee resource groups, or what we call communities of interest. We started that with just 2 or 3 as a pilot for our managers. And then it's kind of evolved to where we have 6 now. It's open to any team member in any restaurant at any level. And we've seen a huge increase in engagement. The restaurants that are more engaged in these COIs, we see an increase in sales and traffic, which is, a win for everybody. But the whole point of that is the more purpose-driven, the more community, the more we take care of each other. It's a win for both the business and the individual. And so it's one of our big, like as I mentioned before, one of our big strategic pillars is that team member experience, and that's a big, big part of our culture and our organization.
Steve, as a regular customer of Chili's, I can tell you that a lot of these things show through just in the day-to-day interactions with your team members at your restaurants.
Well, I'm so happy to hear that, Carol. Thank you very much. I'll pass that along.
Please do.
Jen?
Yes, thank you. So similar to what Steve said, here at Independent Health, wellness is actually on our corporate scorecard. And under wellness is mental health, and under mental health is certainly diversity, equity, and inclusion. We know that associates need not only a physically safe workplace, but a psychologically safe workplace. And so here at Independent Health, we have multiple cross-functional teams that work on these initiatives. Our diversity, we call it our DIBS team, Diversity, Inclusion, and Belonging Strategy team, they meet regularly. And that team is comprised of associates from all different backgrounds and cultural beliefs. And they discuss different things, both internally and externally, what's happening in the community. And they work with HR and our training center, and they work with other committees that go out into the community. And then they listen, and then they react. After that horrific TOPS event that happened here in Buffalo, our associates came together, and then we went out into the community and we helped bring resources and things to the community. One of the most recent focuses that we have internally here at Independent Health also is an initiative around inclusion and intentional connection. And it's a priority for us next year in 2023. We just had a special event here at work. It was an entire week that was dedicated to connection and how we as leaders and associates can look for more trainings and education and opportunities and events around this topic next year. But we don't just do this within our own organization. We really bring this out into the communities that we serve. We have our Independent Health Foundation, whose mission is really to bring meaningful programs and resources to those underserved populations with things like education or sports programs or biometric screenings. And many of these, we partner with local organizations, and we deliver these programs either free or at a low cost. We work with other local officials, and we really try and bring as many health and wellness resources out to our members and the public. So we focus in different ways on diversity, inclusion, and belonging, not just with our own associates, but We even leverage the data that we have in our HRAs to look at, what are individuals in need of? Are they in need of, food? Is there food insecurity? Do we need to provide ride sharing or in-home services? So we really try and take a holistic approach, not just a clinical approach either as an insurer, but really mind, body, soul. And we look at all different concerns. And so, our mission really truly is to bring healthy to you. And that includes diversity, equity, and inclusion.
Jen, yeah, so I only have one last question, because then I really do want to get into this audience Q&A. There's some fantastic questions that folks have. And keep them coming. I absolutely love the chat and everything you're sharing in there. Some really great points. But this last question I have for Carol, just what advice do you have for leaders seeking to improve mental health in the workplace? Another broad one. You're solve all the health issues. Go.
Let's see, where do we begin? Thank you, Taylor. I'm going to share a few perspectives as a leader, but I've also asked Felicia Nermson, who's our Managing Director of Employer Services, to come in and tell me whether what I say actually hits the ground in terms of the real life experience of our team. But I'm a boomer. I was brought up in an era where good leadership was thought to be a matter of technical skill or intellectual skill. You had some expertise, whether it's marketing or engineering or finance. And in order to succeed, you had to succeed at the competitive hustle. You had to win influence. You had to win people over. You had to argue and have a great deal of self-confidence. And I think all the time about how inappropriate that type of leadership really is for today's times, and how much less it's about IQ and how much more it's about EQ. And the concept of empathetic leadership is getting quite a bit of play. And I just wanted to name a couple of things, a couple of ways that I think about it as a leader who's always trying to do better and better. And some of this, I will say, I have learned from painful experience. But fundamentally, I think what empathetic leadership is about is just an understanding of our shared humanity, and the fact that all of us at every level of the organization are going through grief and loss and pain and fear right now. And so ultimately, the sort of three tenets: one has to do with authenticity and vulnerability, the other has to do with empathy, and the third has to do with flexibility. What do I mean by authenticity and vulnerability? We have to be honest with our people, and we have to breed trust. We have to connect with each other in completely new ways, actually probably in some sense the ways that we should have been doing all along, but we weren't sure. And that means that as a leader, it doesn't really matter whether you have the answers. It doesn't matter whether you have any missteps. What's important to people is knowing that you genuinely care. Your people need to trust you. They need to understand that you understand that they're human and they're going to make mistakes. And, one of my favorite leadership gurus, Doug Conant, will say that when you show up with authenticity and vulnerability, that opens up the door for others to follow suit. And we really like to talk a lot in our business about bringing your whole self to work. And indeed, when you open up that door, what you're opening up the door to do is to contribute to the health and well-being of your whole team, and allowing people to bring their whole self to work. A woman named Liz Wiseman, who I also admire, talks about the need to be a multiplier. The need that when you're a multiplier, your job is not just to get top performance of your team, but it's really to be the leader of the well-being of your team. And I would ask all of you on the call who have described fantastic programs that are clearly hitting the ground that way, I would imagine that your leaders of these giant companies are thinking in these very same ways. Think about empathy. What is empathy? Empathy is very different from sympathy. It's not just feeling bad for somebody. It's really being able to put yourself in the shoes of somebody else, to experience what they're experiencing, to stand alongside them and really put their needs in front of your own, to really understand what drives them, what scares them, What are they facing at home that they're bringing in to work undoubtedly every single day? And in that sense, you think about the golden rule versus the silver rule or the platinum rule. The golden rule is you do unto others as you would have them do unto you. The silver rule or the platinum rule is you do unto others as they want done unto them. And then finally, flexibility. You know, we all know that flexibility is important, that being open to the values and to the beliefs of your team are absolutely critical for innovation, for creativity. It also happens to be true, I think, in my own experience, that when you're flexible with people and when you're including them in your decisions and you're genuinely asking for people is advice and their ideas and you're incorporating them into your own decision making, that you're really allowing them to not only be creative and innovative, but you're really breeding that sort of empathetic leadership. And most importantly, what I have learned is these things don't necessarily come naturally. They really have to be practiced with intentionality. I think about these things half of my day since the pandemic started, and it was clear that a new type of leadership was going to be important. And it was clear that we really have to start leading in new ways, in ways that are really in tune with our people. So I want to describe one situation with Felicia, who's going to be on and going to be keeping me honest here. Felicia struggled a few years ago, at the very beginning of COVID, before we even knew there was a pandemic, the end of 2019, was struggling, experiencing COVID. We didn't name it, we didn't know it, but clearly struggling, clearly having trouble focusing, clearly having trouble just getting along with people, clearly in a state where she needed help and support. We have 15 people in our organization. Felicia is one of our top performers. She's one of our top people. I was left with this dilemma of how do we accommodate this top performer while at the same time not overburdening all the others who were left outside and having them have to step up to the plate. It was a terrible dilemma for me, but ultimately what became clear to me, in part because of my own experiences with anxiety and depression, what became clear to me was that accommodating Felicia and really trying to do whatever we possibly could for her and bring all of the organizational wherewithal to help her was going to be called for. I'm going to stop there and I'm going to ask Felicia to jump in and tell us about your own experience. And if you would, please tell us about the things that I've said that you're like, I'm trying, Carol, but
I'll do this really quick because I do want to hear from others, but I will say that when it comes to that empathy, it really is what worked for me. Having Carol share her own experiences with me more than once, it took more than once. It was not easy for me to even have the conversation or to say, yes, I needed help. And I needed help. And there was no doubt about it. There were some things that Carol would say that I couldn't believe. I wasn't going to believe it, no matter what she said. You know, I wasn't in jeopardy of losing my job. I did not believe that because I knew in some way that I was not performing the way that I needed to perform. And there were, when there are days that you can't stand yourself, that how can anyone else possibly stand you? It was really hard, but I can tell you it does work. When you come at it with empathy and you are consistent about it, I will say Carol never gave up. It really made it so much easier for me to say, yes, I need help. And I ended up taking 2 months of medical leave. It was not easy on the organization. They did save my position for me. They didn't have to. That's the size of organization that we are. And they worked through it and it was difficult. But I will be forever grateful for Carol being able to share her own experience and being able to help me walk through my own without saying, Felicia, I think, you're depressed or you have anxiety. I had my sister to do that. But it was really important. So all I can say is if you're struggling, if you're having a hard time, definitely find someone within your organization that can help you, that you trust, and just keep working at it. There are definitely resources out there for you. So thank you.
I really appreciate you and Carol sharing that, just real life experience, because these are the types of things that happen all the time, and for positive or negatively. But I hope to leave just some time for two of our questions from our audience. I'm like getting teared up, so I'm sorry. I'm trying to get trying to get my words back together. And we've had some great questions, and I wanted to start with, I think this is a really good one for you, Lori. Someone asks, and I have to find it. I've been scrolling through quite a few of them here. Hearing a lot about grassroots, grassroots solutions. How are you involving employees in designing these strategies or these solutions? Because it's one thing to have leadership be very vocal about this, but if that's not a support, what can employees do to take that initiative and lead? And I'll start with Lori, but then if someone else wants to add as well, that'd be great.
Sure, this is Lori. That is a great question, because needless to say, you need it at all levels. You need, the cliched tone from the top, you need the modeling. But a hallmark of what we've been doing, and I think one of the reasons why it's really being successful, is it did bubble up from our people to our people. From the beginning, there was an understanding that support, listening, caring, flexibility is not just the task of leadership. It rests with all of us. We have to look after one another. And so the genesis for our entire focus way back 6 years ago, proactively on mental health issues, was from our people. It came from our resource group. We put together the agendas and the content for a series of events that were based on storytelling. 6 years ago, people weren't as open as they are now. And so we solicited stories from people in each office anonymously to an anonymous mailbox, and then we cleansed them of all identifying information. And in these events that I'm talking about, we had stories read by people from the planning committee in that office, and that was anybody who cared about the topic. So the genesis was from our people. The stories were our people. The events were put together by our people, for our people, and our employee assistance professionals backed us up. But all of the basic work focused on our people preparing our people to support one another and to show that they care for one another. And I think that's really critical. And then we built in a leader modeling piece. We were shocked when we made it a requirement that to have events in the office, they had to be led by the office managing partner, and that office managing partner needed to kick off with a personal story. And we were shocked to find that almost all the office managing partners told a story about themselves or their immediate family members. We didn't put restrictions on what the stories could be. They could be very distant experiences that they had. And they were all very personal. And we had many people after these events approaching the office managing partners with their own stories. That really opened up the floodgates. So it started at the grassroots. Leader modeling was built in at the beginning, and as we evolve it into a focus on caring conversations rather than signs, but just a routine part of what we do, the focus is again on our people supporting our people.
Right. Did anyone want to add to that? And then I think I want to cram in one last question before we close. Okay, great. Let's get on to the last one. I think this is a really fantastic question, but how do you care for your team with empathetic leadership if your own leaders aren't doing the same? I hear this, very often, that people are passionate about this. Everyone's impacted one way or another, but leadership isn't really responsive to these requests, or haven't been as active as all of you in tackling these issues and taking care of their employees. So I'm going to open it up to everyone and see if anyone wants to jump in and if they have any suggestions when leadership is just not modeling that behavior or isn't, receptive to this idea.
Taylor, I would suggest that fortunately, there's more and more research about empathetic leadership. And there's research that shows that it works. And it's not soft stuff. And it's not, oh yeah, there's the EQ stuff as opposed to the IQ stuff. It's real. And these are techniques that have been proven, and more are being proven to work. So citing that kind of data and research is a very powerful tool. October is coming up, Disability Employment Awareness Month. This is a wonderful time because I can assure everybody on this call that CEOs are worried about this. This is top of mind for them now, and that they're struggling just as I was and others are as leaders about how to deal with this. Data's out there, and use it.
I would agree with Carol. There's a tremendous amount of data out there, and certainly a lot of our employees are very concerned about the mental and emotional health of their associates. But to the manager out there who might be listening, who says, my company just hasn't latched onto this yet, or really hasn't embraced this fully, my best advice to you is to make a difference. Be authentic and be vulnerable. And I know we've said that, my team sees me when I'm a hot mess in the morning. My 14-year-old's blowing up my kitchen. I'm trying to do a meeting. He's late for the bus, and they see that. And they're like, okay, Jen's just like me. She struggles, so you have to, that empathy, but also you have to be real with them as well, and let them know that you are human as well, and you struggle just like they do. And when you're vulnerable, they are more likely to be vulnerable with you and trust you and talk with you.
So I want to
And
tag into
Steve?
that too. Yes, I fully agree with everything everybody just said, but I'm going to take a slightly different twist on it. I would encourage you to tie it back to the business. And what I mean by that for us, turnover in the restaurant industry is a huge challenge. And what we've seen, the leaders that show empathy, that truly care about the team members in their restaurants, their turnover is far well below a lot of other restaurants that don't have that type of leadership support. And what that means for that manager is they don't have to spend as much time training, retraining, rehiring, going through a lot of different costly processes. So I would encourage you to talk to your management teams about tying it back to the business and how it can actually make an impact to their the bottom line, and not just focus on all the important things that we know about empathetic leadership, but how to actually make a difference to the business itself.
And Steve, your insurers can help you with that data. We can provide that data to our employer groups to really demonstrate that, if you can help someone that might just be experiencing a little bit of stress and anxiety and emotional health before it becomes a full-blown disorder of anxiety or depression, they're also going to save dollars, and they're going to help those individuals be more productive at work and not, be stressed out and be focused on, what they're supposed to do. And to your point, when they care about their associates are not going to leave. They're going to stay. So,
Absolutely.
Our groups, we certainly help, and we translate all of those dollar signs for them. And that's why they're fully embracing our mental health toolkit. But any insurer should be able to provide that information as well.
this is
Well,
Lori.
so
I just
much.
want to add one thing.
You got, I'm gonna have to cut you off, so give me
Oh, okay.
30 seconds, 30 seconds.
30 seconds. There's also a strong correlation with productivity, and a lot of data on that. Turnover, productivity, there are many hard measures that are impacted by an environment that's emotionally supportive or not.
Thanks. Sorry about that.
Right, and I have
I
lived
just
it,
wanted
so
to,
go ahead, Taylor.
so yeah, no, I just want to close this out because I want to be attentive to people's time here. But this was just part one of a part 4 of a 4-part webinar series. You'll see on the screen here, all of these sessions are being recorded, including this one. So if you have to leave, please do so. And this will be available. I know MHA is going to put it up on their site as the full series, and I think NOG is doing something similar. Big shout out and thank you to our panelists for sharing all your different perspectives, Carol, Lori, Stephen, Jennifer, and Felicia for being a part of this. Really appreciate it. Thank you to everyone who joined us today. We know that you're passionate about this, and this is why you participate in things like this. So we hope this information was valuable to you. And then Felicia, I don't know if you have one thing to add, but
I just want to say thank you. I want to say thank you to you, Taylor. This has really been a fantastic partnership, and we're going to bring it into 2023. So thank you everyone for staying with us and for sharing your own experiences in the chat. We just have really loved this whole series. So thank you everyone. And thank you to the panelists today. You were fantastic. Thank you.
Thank you.
have a great day, everyone.
Thanks.
Thanks, you too.
Thank
Bye.
you.